Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, doctor. Thank you for seeing me on such short notice.
Good morning. Don't worry about it. That's what I'm here for. What seems to be troubling you?
I've been experiencing severe abdominal pain for the past week. It's mostly on the right side, and it's intense enough to wake me up at night.
May I ask your age?
I'm 52 years old, doctor.
Have you been taking any medication for this pain?
Yes, I tried over-the-counter antacids and ibuprofen, but they haven't helped much. The pain seems to worsen after eating fatty or greasy foods.
Do you smoke or consume alcohol?
No, I don't smoke and I rarely drink alcohol.
I've reviewed your blood work and ultrasound results. Your liver enzymes are elevated, and the ultrasound shows gallstones and a slightly enlarged gallbladder. It seems like you're suffering from gallstone-induced cholecystitis. Your vital signs show a blood pressure of 135/85 and a pulse rate of 78. There are no signs of jaundice, but you do have some abdominal tenderness upon palpation.
What does that mean? What's our plan of action?
Given your symptoms and the results of the diagnostic tests, I recommend surgical removal of the gallbladder, known as a cholecystectomy. I would like to perform further tests, including a hepatobiliary immunodiacetic acid (HID) scan to confirm that the gallbladder is not functioning properly before we proceed with surgery.
That sounds serious. Is the surgery risky?
All surgical procedures come with some degree of risk, but laparoscopic cholecystectomy is generally considered a safe and effective treatment for gallstone-induced cholecystitis. However, we'll conduct a thorough preoperative evaluation to assess any possible risks in your case.
Okay, let's proceed with the additional tests then.
Great. I'll have my staff schedule you for a HIDA scan and a preoperative evaluation. After we have those results, we'll finalize the treatment plan.
Thank you, doctor. I appreciate your thorough approach.
You're welcome. It's important to address this properly to prevent any complications down the line. I'll see you soon for the follow-up.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Thank you for coming in today, Ms. Johnson. I see you've been to your primary care physician regarding a series of headaches and bouts of dizziness. Could you elaborate on that?
Yes, doctor. It started a few months ago, and it's been really distressing. The headaches usually happen in the afternoon, and they're throbbing, mostly on the left side of my head. Light and sound make it even worse. The dizziness is unpredictable, but has almost caused me to fall a couple of times.
That does sound concerning. Is the headache constant, or does it come and go?
It comes and goes, but when it's there, it's almost debilitating. Over-the-counter medication doesn't seem to help much either.
Any other symptoms that accompany these episodes? Maybe changes in vision or nausea?
Yes, actually, I do feel nauseous often, especially when the headache is intense. And I've noticed my vision gets a bit blurry sometimes, mostly when I'm dizzy.
I see your GP referred you for an MRI. Did you have that done?
Yes, and they told me that the results didn't show anything abnormal. So I'm really not sure what's going on, but it's affecting my quality of life.
Understandable. Have you tried any lifestyle changes or other methods to alleviate these symptoms?
I've tried everything from changing my diet to incorporating exercise into my routine. A friend suggested aromatherapy, which seemed to help a tiny bit, but it's not a long-term solution. I've been drinking herbal teas too, which calm me down, but don't really address the headache or dizziness.
Do you have a family history of migraines or similar symptoms?
My mother used to complain about migraines, but she managed hers with medication. No one else in the family has anything like this as far as I know.
Thank you for the detailed information, Ms. Johnson. Based on what you're describing and your family history, this could be related to migraines or another form of chronic headache, possibly accompanied by vertigo. We may need to explore more specialized tests and consider various treatment options like prescription medications.
Thank you, doctor. I just want to get to the bottom of this and start feeling like myself again. It started to interfere with my work and social life.
I understand, and we'll do our best to find a treatment that works for you. You're not alone. Many people experience symptoms like yours, and there are various treatment paths we can take. But first, let's get a more comprehensive diagnosis. I'll set you up for some more specialized tests.
I appreciate that. Hopefully we can figure this out soon.
I'm optimistic that we will. Thank you for coming in today. We'll be in touch soon with the next steps.